Hi, I am Frankie.
I am Dana.
And I am Rachel.
We are 4th semester developmental service worker students.
We would like to share a video with you about barriers that people with developmental disabilities experience when accessing medical appointments.
We hope that you enjoy our video. Please let us know if you have any questions.
Having a developmental disability does not mean that a person is sick. However, many people with developmental disabilities have increased health concerns. Receiving treatment involves several barriers. A Toronto-based study has found that over 32% of people with developmental disabilities face physical barriers while accessing medical facilities. While a Canadian study showed that at least 20% of people with developmental disabilities feel that physicians over-attributed their health problem to their disability. Now, look at this crowded waiting room. Think about all the things that could create a barrier. What about the barriers that you cannot see?
Accessibility is talked more and more about today. Medical appointments are a great place to look at ways to improve upon making society more accessible. Barriers that are faced when attending medical appointments include healthcare providers assuming symptoms are part of their disability. Healthcare providers' fears of the disability, or not having knowledge of their disability. Lack of time to make the appointment accessible and successful. Barriers to language, especially if the person is nonverbal. Assumptions that the information that the healthcare provider is giving will not be understood by the person with the disability. As well, there are physical barriers that impact the success of an appointment. For example, a person in a wheelchair might not be able to stand to be weighed. A person that rocks to cope may not be able to use an automatic cuff to have vitals taken. Think about other barriers that may impact a successful appointment.
What if we take the disability out of the equation? Would that make the symptoms more important? Would it change their meaning? People with disabilities are about 4 times less likely to seek medical attention than non-disabled people, due to the barriers that will be faced. Many tests like cancer screenings are not performed regularly on those with developmental disabilities. An appointment with barriers that lacks accessibility could mean a missed cancer diagnosis, a missed heart condition, a missed UTI, a missed diagnosis of depression, a fatal missed infection. The list could continue. If we simply take the barriers out, many things could be improved within medical appointments. More complete care with adequate tests and screenings. Improved relationships between the patients with disabilities and their healthcare teams. Less overlooked medical issues. And longer, healthier lives for those with developmental disabilities. So, how do we take the barriers out? How do we help appointments to be more successful for everyone?
Overcoming barriers to medical appointments is a team effort. It involves the person with the developmental disability, any support care they may have, the office staff, and the person performing the medical care. Being aware of the barriers will bring attention to the fact that there needs to be a change.
When working with someone to make appointments more successful, the strategies start before they even arrive at the appointment. Have regular visits to the waiting area days or weeks before the appointment. Having time to sit and be in the space without any expectations allow it to become familiar. Make an appointment to meet the nurse, doctor, and front clinical staff ahead of time. This appointment is only to meet the medical team, not to discuss medical issues. It is also a good time to give a book about the person and communication strategies for future visits. Go to the waiting area, get used to the sounds, smells, and sights.
Accessibility can include providing extra time for clear explanations and processing the environment. Ensuring that the person with the developmental disability is being addressed, not their support staff. Working with the doctors to welcome support in the room. Try to have appointments during less busy hours. Dim the lights. Remove anything that might be overstimulating. If you are not sure what is causing them to feel overstimulated, ask. And have the information provided to the person in a variety of ways for a more complete understanding. Many barriers can be overcome by listening to the person and treating them as though they do not have a developmental disability.
Barriers can be physical objects and physical actions. Being flexible and working with the person will help. Think outside of the clinical way. Taking a pulse, for example, an automatic cuff is one way, but if it is not going to be successful. What about manual? What about lying down instead of sitting? Eating while taking it? Or having the lights off? Our goal today is not to tell you how to make everything accessible and how to make every barrier disappear. It is to bring awareness that there are barriers. Being aware, and thinking differently about how to get the most success from the appointment will increase the care of the population of people with developmental disabilities.